Upper motor neuron lesion or lesions of the corticospinal tract. The lesion of the corticospinal tract or upper motor neuron lesions results in hemiplegia with or without the involvement of cranial nerves. The clinical features or signs of the upper motor neuron lesions are: number 1, spastic paralysis. That is, when the upper motor neurons are damaged, it loses its control over the lower motor neuron. So consequently, this results in hyperactive of lower motor neurons. So this causes hypertonia, that is increased muscle tone, spasticity of the muscles, that is abnormal muscle tightness due to prolonged muscle contraction, and exaggerated tendon reflex, that is knee elbow reflex, that is biceps tendon reflex and knee reflex are exaggerated. Babinski's sign is present when the lateral part of the sole of the foot is scratched with a blunt instrument. Usually the toes will flex, plantar flex. The great toe is dorsiflexed and the lateral toes fan outside. That is the Babinski's sign. So in upper motor neuron lesions, the Babinski's sign is present. Superficial abdominal reflex is absent in upper motor neuron lesions. When the skin over the anterior abdominal wall is scratched, the superficial abdominal muscle will contract, but in upper motor neuron lesions, it is absent. Cremastic reflex is also absent. When the skin over the medial side of the thigh is stroked, cremastic reflex takes place, but in upper motor neuron lesions, it is absent. Loss of performance of fine skilled movements are absent in upper motor neuron lesions. Muscle clonus is present, that is, uncontrolled rhythmic movement is present in upper motor neuron lesions. So what is the difference between upper motor neuron lesion and lower motor neuron lesion? In upper motor neurons lesion, the neurons present in the cerebral cortex is mainly damaged. In lower motor neurons, the anterior horn cells present in the gray matter of the spinal cord is damaged, or the motor nucleus of the cranial nerves is damaged. In upper motor neurons, you have hypertonia, increased muscle tone. In lower motor neurons, you have hypotonia. Spasticity of muscles is present in upper motor neurons, whereas in lower motor neurons, flaccidity of the muscles can be seen. Exaggerated tendon reflex is present in upper motor neuron lesions. The tendon reflex is weak or absent in lower motor neurons. Muscle clonus is present in upper motor neuron lesion. It is absent in lower motor neuron lesions.